Welcome to the training course on empowering community health workers on kidney failure and care. My name is Lori Garrett. I'm proud to be a member of the advisory board of the Missouri, Kansas NKF chapter. Here are some pretest questions to see where we're at in our learnings thus far. What is the primary function of the kidneys in the human body? The answer is C, to filter waste and excess fluids from the body. Question 2, true or false? Community health workers play a crucial role in promoting kidney health and supporting patients with kidney failure. Of course, that answer is true. Question 3, why is early detection important in managing kidney failures? And the answer is B, because it allows for better treatment options and can prevent complications. Let's do a quick refresher on what the definition of kidney failure is. Kidney failure is a condition where kidneys can no longer filter waste and excess fluids from the blood properly. This can lead to a buildup of harmful substance in the body and disrupt the balance of essential minerals and fluids. Common symptoms of kidney failure can include feeling tired. If a patient is always tired, it could be a sign that the patient's kidneys aren't working well. They help remove waste from the patient's body, which can make you feel exhausted if they're not doing that. Another sign or symptom could be swollen feet and ankles. If a patient's feet and ankles are getting swollen, it may be due to kidney problems. Healthy kidneys balance the fluid in the patient's body, but when they're not working right, fluids build up and cause swelling. Difficulty sleeping. Kidney issues can sometimes lead to trouble sleeping or falling asleep, making a person feel very cranky and not well rested. Changes in urination. Patients should pay attention to how often they pee and if there are any changes. Kidney problems can cause them to pee more or less often than usual, and the pee might look different too. Blood in your urine. If you notice any blood in the patient's pee, it is essential to tell the patient's doctor right away. Blood in the urine can be a sign of kidney trouble. Nausea and vomiting. When a patient's kidneys are not working correctly, waste can build up in their body and make them feel sick, leading to nausea and vomiting. It further can lead to a loss of appetite. If a patient is not feeling hungry and not eating well, it could be because the kidney problems are affecting their body's ability to process foods. Remember, these symptoms don't always mean a person has kidney failure. Still, they must talk to a doctor if they are experiencing any of these signs and symptoms. Early detection can help better treat and keep patients' kidneys healthy. Also, kidney failure and the symptoms associated don't always present overnight. They often take months or years to set in, and so people may not even notice them. We're going to start with an end-stage kidney disease overview and helping community health workers understand the treatment options. As a CHW, you can support people with chronic kidney disease or CKD by helping them find the resources to learn more about their treatment options and ensuring that clients and community members can understand the facts of all their treatment options. There are multiple treatment options to treat kidney failure, such as conservative management versus dialysis versus kidney transplantation. Let me say just a bit more about these. First, a conservative treatment approach consists of non-dialysis or supportive care that focuses on managing the symptoms and complications of kidney failure without relying on dialysis or a kidney transplant. We'll say more just in a minute. But second, let's talk about people who may need dialysis and/or a kidney transplant. Because their kidneys are no longer working to remove enough waste and fluid from their blood to keep them healthy. This usually happens when only 10 to 15% of their kidney function is left. We'll also discuss factors affecting treatment decisions and provide an overview of each of the treatment options, benefits, and challenges. Regardless of the pathway selected, a combination of medications, dietary changes, fluid management, blood pressure control, pain management, lifestyle modifications, managing anemia, which is low iron in your blood that doesn't allow your blood cell to carry enough oxygen, emotional support, and counseling and/or palliative care may be provided to address pain and other symptoms. So let's talk more about conservative management. As I said before, conservative care treatment approach consists of non-dialysis or supportive care that focuses on managing symptoms and complications of kidney failure without relying on dialysis or a kidney transplant. This approach is often chosen when dialysis or transplantation may not be suitable for various reasons, or the patient prefers a more holistic approach in managing their condition. The treatment goals of conservative management are preserving kidney function as long as possible, managing symptoms such as a poor appetite and emotional health, managing other problems caused by kidney failure such as anemia, maintaining quality of life for as long as possible. Community health workers can support the patient by being an advocate and acting to ensure their voices are heard and their preferences are respected. Further, you can help patients and families navigate the healthcare system and access the necessary resources. So let's begin to talk about dialysis. In this section, the next several slides will provide a comprehensive understanding of the dialysis process and the two primary types of dialysis: hemodialysis and peritoneal dialysis. So let's embark on a journey of discovery, starting with the exploration of the dialysis process itself. The first dialysis option is hemodialysis. Here's how it works. Blood is taken from the patient's body and cleaned in a special machine before it is returned to their body. It's like having your blood filtered outside of your body. It's usually done in a dialysis center, and you'll need to go there several times a week. It is also possible to get dialysis at home in certain situations, and we'll talk more about that in a bit. The treatment time, each session lasts a few hours, and the patient will have to follow a fixed schedule. They will need an access point, which requires a small surgery needed to create a vascular access point in the arm or the leg for the machine to connect into the blood. More about the types of access in the next few slides. Caregiver needed. The patient will need someone to take them to the dialysis center, as people are generally too tired to drive home afterwards. If they're doing dialysis at home, they'll need a caregiver to help administer treatments. So let's talk about hemodialysis access points. There are three main types of hemodialysis access: arteriovenous, AV or AVF fistulas, arteriovenous, AV or AV graft, AVG grafts, central venous catheter, otherwise known as a CVC. So now let's talk about peritoneal dialysis. How it works is it uses the space in the abdomen called the peritoneal cavity as a filter. The access point is usually a soft tube called a catheter that is placed in the abdomen to connect to this space. A special fluid called dialysate is put into the abdomen through the catheter. The dialysate helps remove waste and extra fluids from the body. Passing through the peritoneal membrane into the dialysate, after a few hours, the used dialysate is drained out through the catheter. There are two types. One is where the patients manually do the exchange, called CAPD, and one is using a machine during sleep, called APD. Treatment time. The process is repeated multiple times a day, CAPD, or done at night, APD, to help the body get clean and balanced. Peritoneal dialysis can be done at home and offers flexibility compared to other treatments. So let's summarize hemodialysis versus peritoneal dialysis. Peritoneal dialysis offers more flexibility and can be done at home, allowing for more continuous form of dialysis. Hemodialysis, on the other hand, is typically done in a dialysis center. It involves fixed schedule and has stricter dietary restrictions, but is often the choice when home-based treatments are not suitable. The choice between the two depends on the individual's preferences, lifestyle, and medical considerations. Next, let's talk about transplantation. Kidney transplantation. Well, what is a kidney transplant? This is when a healthy kidney is placed inside the body to do the work that the patient's own kidneys can no longer do. The healthy kidney can come from someone who has died and chosen to donate, called a deceased donor, or from someone who has two healthy kidneys and chooses to donate one, called a living donor. For many people whose kidneys have failed, a kidney transplant can offer more freedom and a better quality of life than dialysis. Let's talk about the kidney transplant process. The kidney transplant process is a complex but life-changing procedure for individuals with kidney failure. Here is an expanded summary that covers eligibility criteria, preparation, evaluation, and the psychological assessment. It is crucial for the patients to remain physically and mentally prepared for the transplant, maintain a healthy lifestyle, and adhere to prescribed medications. In summary, the kidney transplant process involves a thorough evaluation of the patient's physical and psychological health, placement on a waiting list for a deceased donor, and extensive preparation and education. Eligible candidates are then monitored and prepared for the transplant while awaiting a suitable organ match. The ultimate goal is to provide recipients with a functioning kidney, offering a chance at a healthier and more fulfilling life. Let's talk about what happens after the transplant. First off, you see, the patient usually will celebrate. So let's give kudos to this gentleman for having his kidney transplant. But post-transplant care refers to the comprehensive management and monitoring that a kidney transplant recipient undergoes following their surgery. The care is structured to support the recipient in adjusting to life with their new kidney and involves a multidisciplinary team approach, including nephrologist, somebody who specializes in kidney disease and health, transplant surgeons, dietitians, and other specialists. The focus is on monitoring the function of the transplanted kidney, managing medications, and ensuring the recipient's overall well-being through lifestyle adjustment and regular medical follow-ups. So post-transplant care can look like this: regular checkups to monitor the function of the new kidney and identify any signs of complications early on, administering and managing immunosuppressive medications and other drugs to prevent the rejection and manage other conditions, guiding patients on making the necessary adjustments in their diet, physical activity, and other lifestyle factors to support the longevity of the transplanted kidney. I would like to thank the following organizations for supporting the community health worker training: AstraZeneca, Bayer, and the Missouri Department of Health and Senior Services. Thank you. Please take the following survey to help continue to shape the community health worker training, tools, resources associated with chronic kidney disease. Please click this QR code. For more information about NKF's Community Health Worker Program, you can click on this link.